What is the liver? Functions of the liver. Liver conditions. Liver disease symptoms. What is a liver biopsy? What kind of doctor treats liver disease? The liver is one of the vital organs of the body, responsible for hundreds of chemical actions that the body needs to survive. It is also a gland because it secretes chemicals that are used by other parts of the body. For these reasons, the liver is both an organ and a gland. In fact, it is the largest internal organ in the body. Production of bile, which helps carry away waste and break down fats in the small intestine during digestion. Production of certain proteins for blood plasma. Production of cholesterol and special proteins to help carry fats through the body. Conversion of excess glucose into glycogen for storage. This glycogen can later be converted back to glucose for energy. Balancing and production of glucose is needed. Regulation of blood levels of amino acids, which form the building blocks of proteins. Processing of hemoglobin for distribution of its iron content. The liver stores iron. Conversion of poisonous ammonia to urea. Urea is one of the end products of protein metabolism that is excreted in the urine. Clearing the blood of drugs and other toxic substances. Regulating blood clotting. Resisting infections by producing immune factors and removing certain bacteria from the bloodstream. Clearance of bilirubin. An accumulation of bilirubin will turn the skin and eyes yellow. Hepatitis. Inflammation of the liver, usually caused by viruses like hepatitis A, B, and C. Hepatitis can have non-infectious causes too, including heavy drinking, drugs, allergic reactions, or obesity. Cirrhosis. Long-term damage to the liver from any cause can lead to permanent scarring, called cirrhosis. The liver then becomes unable to function well. Liver cancer. The most common type of liver cancer, hepatocellular carcinoma, almost always occurs after cirrhosis is present. Liver failure. Liver failure has many causes including infection, genetic diseases, and excessive alcohol. Ascites. As cirrhosis results, the liver leaks fluid, ascites, into the belly, which becomes distended and heavy. Gallstones. If a gallstone becomes stuck in the bile duct draining the liver, hepatitis and bile duct infection, cholangitis, can result. Hemochromatosis. Hemochromatosis allows iron to deposit in the liver, damaging it. The iron also deposits throughout the body, causing multiple other health problems. Primary sclerosing cholangitis. A rare disease with unknown causes. Primary sclerosing cholangitis causes inflammation and scarring in the bile ducts in the liver. Primary biliary cirrhosis. In this rare disorder, an unclear process slowly destroys the bile ducts in the liver. Permanent liver scarring, cirrhosis, eventually develops. Skin and eyes that appear yellowish, jaundice. Abdominal pain and swelling. Swelling in the legs and ankles. Itchy skin. Dark urine color. Pale stool color, or bloody or tar-colored stool. Chronic fatigue. Nausea or vomiting. Loss of appetite. Tendency to bruise easily. Most often, diseases of the liver can be diagnosed by history, physical examination, and blood tests. On occasion, should the diagnosis be unclear or to assess the degree of damage to the liver, a liver biopsy may be necessary. Using a very thin needle, a gastroenterologist or hepatologist, two types of liver specialists, or an interventional radiologist will insert a very fine needle through the skin and into the liver, to retrieve a small bit of tissue. This can then be examined under the microscope by a pathologist to help make the diagnosis. This procedure is done under sterile conditions to prevent infection, and a local anesthetic is injected into the skin to decrease the potential for pain. If there is concern about only one area of the liver, instead of a disease that would affect the whole organ, an ultrasound may be used to help guide the needle into the proper position. Diseases of the liver may be treated by primary care or internal medicine specialists. Gastroenterologists are specialists that focus on the digestive organs and liver. A hepatologist is a specialist focused exclusively on the liver. Depending upon the exact type of liver disease, other specialists may be involved in the care of patients with liver disease, including infectious disease. Specialists, surgeons, oncologists, critical care specialists, hematologists, and emergency medicine specialists.